When you're diagnosed with a lifestyle disease, today specifically type 2 diabetes, prediabetes, when you're diagnosed with it and your doctor says to you that you have to start taking insulin, let's say the lowest form of insulin, I want you to understand that when your doctor prescribes that drug, majority of the doctors that out there, they prescribe the drug with the mentality inside of their head that we will never be off of the drug. Meaning, as far as they care and as far as they know, type 2 diabetes is something that you are going to be suffering from for the rest of your days, and their job is to keep giving you medication to treat the symptoms. In their head, they're going to start you off with low dose insulin. But as far as they care, we are incapable of changing the lifestyle we have, which made us pre diabetic or type 2 diabetic. They believe that we are incapable of changing that lifestyle. So, as far as they care, every year after that initial diagnosis, or every other year, or every 3 years, they are just going to be giving us more and more and more and more of that insulin at higher and higher and higher doses. At the initial diagnosis, your doctor will prescribe the low dose insulin, assuming that it's prediabetes and it's not full blown type 2 diabetes. They'll prescribe that low dose insulin, but they will not tell you you should change your lifestyle. They will say you need to exercise more, and maybe you should do the Mediterranean diet. What the hell is the Mediterranean diet? What is that? What does that mean? It could mean anything. That's what they'll say. And then they'll recommend that you see a dietitian or a nutritionist. And then when you go see the nutritionist is going to say to you, the pre-diabetic or the type 2 diabetic, per day, you can consume between 100 and 150 grams of sugar, total grams of sugar. The dietitian and the nutritionist also do not believe that we can change the lifestyle which made us pre-diabetic or type 2 diabetic. If they did, they would recommend, because they should all understand that it's the carbohydrates that's causing you to have the sugar spikes, which meant the insulin spike possible. They should know that. They went to school for that. Day after day, spike. Month after month, spike. Year after year, spike. That's why you are a pre diabetic or a type 2 diabetic. They should know that. So they should want to limit the amount of carbohydrates you consume if the idea is to reverse the disease. Stating that you should take between 100 and 150 total grams of carbs per day is basically saying, instead of putting 93 gas into the fire, we're just going to put 89. It's still gasoline that you're throwing into the fire. If we are diagnosed as pre-diabetic or type 2 diabetic, and our doctors offer us the metformin, the low dose insulin, it is to our best interest to understand that if we change our lifestyle, Change your lifestyle. All it means, start intermittent fasting because chances are great you were not doing that when you became pre-diabetic. Start adopting a low carb diet because chances are great you weren't doing that when you became pre-diabetic. And start exercising. There's a possibility that you were exercising. I was when I became pre-diabetic. We change our lifestyle. We will reverse insulin resistance. We reverse prediabetes. And as long as our pancreas can still make insulin, we will reverse type 2 diabetes. They don't believe that we are capable of changing our lifestyle. We should prove them wrong.